Hey folks, it's Mark. I found an insane study about homelessness where authors looked at data from public databases for people in Denmark over the last 20 years and found that homelessness is associated with losing about 15 years worth of life expectancy. In this video, I'll break down the data, talk about what's driving those excess deaths, and try to share some of that information. If you want to learn more about this kind of research, like, subscribe, and let's get into it. So this study was published in Lancet Public Health. That's a peer-reviewed journal, and it's by a group of researchers that are mostly from Denmark. And what the authors sought to do in this study was look at the effects that homelessness has on mortality and what the causes of that mortality were. So the study used data that was available from public databases on homelessness and mortality, as well as disease, that pertained to 6.2 million people in Denmark between the years of 2002 and 2020. That range of dates is important. It means that the data don't reflect at all what happened in the COVID-19 pandemic, since all the data were collected before the pandemic started. That's relevant because you might expect that a pandemic that caused millions of deaths would have an impact on mortality. So this is really isolating under normal circumstances without a century unique pandemic, what the effects of homelessness are going to be on disease and on mortality. The way that the authors evaluated homelessness in this study was using a database of shelter contact. So in Denmark, when people go to a homeless shelter, they're required to show a personal ID number, and then that means that the government and then people doing research like this are able to track those individuals and connect that information on them across the various national registries that they have. An important thing to know about privacy in this kind of study, though, is that all of the data are de-identified. So that means it's not possible to track the data back from this analysis to individual people. And in fact, in the paper, the authors don't even report data down to the individual level, only summary statistics. So let's get into what they found. Unsurprisingly, people who experienced homelessness or had at least one contact with a homeless shelter in this window of time had a lower life expectancy. That's not a new finding. It's been shown in other countries, including the United States, and it's not even unintuitive. You think about it, people, if they're unhoused, they're going to be more likely to be susceptible to disease, have lower medical care, lower access to clean food and water, and be exposed to the elements. So that wasn't all that surprising to me. But what's interesting to me about this study is that because the authors are linking information from these various national databases, they're able to directly compare mortality for people who experience homelessness with those who did and those who did not, and then break that down by the cause of death in each case. For people who experienced homelessness, life expectancy was 15.9 years lower on average for men and 15.3 years lower for women. And that's compared to people who never had contact with a homeless shelter. That is an enormous difference. I certainly expected life expectancy to be lower for people who experience homelessness, but 15 years, almost 16 for men, that's insane. To put those numbers into context, the authors of this study showed that the effect of homelessness on mortality was higher than that of schizophrenia, of alcohol abuse, or of drug abuse. When the authors looked at the causes of death associated with homelessness, and this is, of course, excess mortality, there were many. But the biggest contributors to the difference were some of the things that you might expect, like external causes like injury or even self-harm, psychiatric disorders, or diseases of the liver or of the intestine. The contribution of external causes like injury was about 5.2 years of life lost for men and 3.9 years of life lost for women. So this is preventable stuff and is having a tremendous impact on life expectancy. There's one other finding in the paper that's kind of buried, but that I found fascinating, and that was the interaction with cancer. The study found that people who never experienced homelessness, on average, lost more years of life to cancer than those who did not contact a homeless shelter. And the effect size was about 1.2 years of life lost. To put that another way, if you look at the data literally, it might tell you that being homeless is protective against cancer. But that's not the right way to look at it. And it makes sense when you think about how people who never experience homelessness live longer overall. So let's back up and understand what cancer is. So Cancer is a set of diseases that arises from mutations that build up in your cells over time as they divide, and it eventually causes cells of the human body to go rogue. They stop playing by the rules, they start growing and dividing uncontrollably and take over. And the longer that we live, the more likely it is that you build up enough mutation that the checks and balances that are in place on our cells will be broken and that cancer can develop. So if you put that in the context of this study, essentially people who experience homelessness, they're most likely just dying too young, that they're not having as much opportunity for those mutations to build up and for cancer to occur and be diagnosed than people who were never homeless. So just going back, while the data makes it look like homelessness is protective against cancer, I think in reality what it is that people who were experiencing homelessness were just dying earlier. And for that reason, they just weren't living long enough to experience cancer in the way that other people were. The findings of this paper shocked me. And they really emphasize that homelessness is not just an economic issue, it's also a major public health issue. It has bigger impacts on life expectancy than even severe psychiatric disorders and substance abuse. And many of the causes of death associated with homelessness are preventable. Studies like this should really inform discussion on policy around dealing with issues like homelessness. And I hope that more people have the opportunity to view this kind of data and think about it through that lens. As always, a reference to the study that I described is included in the video description. And if you found this interesting, I'd encourage you to like, subscribe, and comment. What are your thoughts on this study? And what do you think we should do about it? I'm trying to share breaking scientific research, and your support really helps me to reach more people and get that message out there. So with that, thank you for watching and have a great day.